Hi. So also, I would like to thank you, the organizing committee, to organize this very nice e-conference. So good afternoon, everyone. Right now, actually, here in Brazil, it's still good morning. And right now I will start my lecture entitled Antimicrobial Photodynamic Therapy from the Bench to the Clinic. So before I start to present my talk, I would like to emphasize that there is no any conflict of interest in this lecture. Before we talk about specifically about antimicrobial photodynamic therapy and its application in dentistry, it's important to emphasize that many people worldwide will be under any kind of oral infection disease. According to the WHO in 2022, at least 3 of 4 people worldwide, especially people that live in low and middle income countries, will be affected by one of the different infection disease. So in this way, we needed to do something to control this oral infection disease. So the most, here I can show you some of these diseases that we can have inside the oral cavity. Of course, not just the microorganisms are involved in the etiology of these diseases. There are many and different factors that can contribute to start these diseases inside the oral mouth. From them, dental caries and a periodontal disease have been described as the most common infection disease that we can have in the oral cavity. So, of course, we needed to do something. Of course, once the disease is already installed, usually we should mechanically remove the biofilm that is described as one of the most important etiological factors for this kind of diseases. Before we talk about antimicrobial photodynamic therapy, it's important to emphasize that we needed to control the oral microbiome. This is not just important to the oral health, but the systemic health. There are many papers already published in the literature that can show the relationship between among the different oral infection diseases and the systemic diseases. So then we needed to do something to control the oral microbiome. Of course, we don't want to kill every or all microorganisms that we have inside the oral mouth. The main purpose is to control and especially the number of the microorganisms that can start these different diseases. So in this way, although we already have many and different antimicrobial agents that we can use in the oral mouth. However, especially once we talk about the chlorhexidine, this is the most important antimicrobial agent used in the dentistry field. We needed to emphasize the disadvantages and the secondary effects of this antimicrobial agent. So in this way, we needed to work on different techniques, on different antimicrobial agents in order to avoid the side effects of the main antimicrobial agents used in dentistry right now. In this way, for sure, and so far, antimicrobial photodynamic therapy can contribute to control the oral biofilms. So let's talk a little bit about antimicrobial photodynamic therapy. Actually, this is a technique that we can use a chemical compound described as a photosensitizer and a light source. And after that, many reactions can take place, and then we can have we can kill the oral bacteria. Antimicrobial photodynamic therapy has been described as an adjunctive method to control the oral biofilm. Of course, once we talk about the dentistry, the mechanical, we still use the mechanical removal of the dental caries, the periodontal microorganisms, endodontic microorganisms, but so far, antimicrobial photodynamic therapy can contribute to control these biofilms related to these different oral diseases. So once we have the association of the photosensitizer and a light source that can, of course, that this photosensitizer can absorb this light, especially two kinds of reactions take place, type 1 and type 2 reactions, and both of them are responsible to provide some different effects and cytotoxic effects over the different microorganisms. So then in this way, to show the efficacy, the APDT over different oral biofilms, we have done here in Brazil in collaboration with different people from around the world, some studies to show the efficacy in the effect of APDT over oral biofilms. This paper was published in, I cannot see, I don't know the reason why there is something just over my presentation. Oops, sorry. So we published this paper where we showed the use of methylene blue and chlorine E6, both photosensitizers used for antimicrobial PDT, and we showed the results over Streptococcus mutans, that is the main etiological factor related to the dental caries, and we could show at least 4 log reduction of the biofilm after PDT, especially once we use it. Just give me one moment. Maybe here. All right, so, and we could show at least a 4-log reduction, where we could also show that chlorine 6 was more effective than methylene blue. Both of these photosensitizers were irradiated under 60 nanometers. It's a kind of, it's a red light. Usually we work with lasers or LEDs and under specific wavelengths that the photosensitizers can absorb. This is interesting that in this work, we also showed that there is a reduction of the concentration of the lactic acid after EPDT. It's especially important once we talk about dental caries, because these different kinds of acids synthesized by the bacteria are related to the demineralization process of the dental structures. So then if APDT can inhibit the synthesis of the different kinds of acids, we can also contribute to avoid the demineralization of the dental structure. So in this way, we have published different papers to show the effect of PDT for the prevention of white spot lesions. Once this kind of lesions is very, very common, especially for patients under orthodontic treatment, and then we have work on that. We also published another paper over periodontal biofilms for different bacteria strains, where we could also show that APDT can demonstrated a strong effect over single species biofilms that are linked with the periodontal disease. So then we can show the CFU reduction, and also the CFU reduction were supported by the confocal images. Once we can see most of cells stained by the red dye. So here we can see for Fusobacterial nucleatum at more than 3-log reduction. For P. gingivalis, we could total inhibit the bacteria load, and for the others bacteria, we could also show, especially for Streptococcus oralis, more than 3-log reduction. In this paper, we used the 2 different wavelengths. Once chlorine 6 can be activated by 450 nanometers and 660 nanometers. Blue light is especially interesting in the dentistry field. Once all dentists have in their dental office a blue light that it's a light source used for other purposes in dentistry. So in this way, we have worked with different kinds of biofilms, different models, and but of course, as all antimicrobial agents and techniques, APDT can show some limitations. Of course, once we talk about biofilms, of course, it's more difficult to kill the bacteria organized as a biofilm. Once we usually have the EPS matrix that can act as a barrier to difficult the penetration of the photosensitizer and the penetration of the light source. Also, we needed to have a look on the different dyes that can stain the dental tissues and the restorative materials. We can also have a look on the light penetration, incubation, and irradiation time. All of these factors can directly impact the results of APDT in dentistry. So then right now we have worked with new strategies and combined therapies in order to improve the results of the antimicrobial photodynamic therapy. In this way, we have now worked with antimicrobial photodynamic therapy associated to the use of ultrasound that can be called as sonophotodynamic therapy. And the very nice thing that we can show is that we are able to improve the results once we combine the use of ultrasound and the antimicrobial photodynamic therapy. And these results have been attributed to the disorganization of the biofilm structure. So in this way, we can have more and a better interaction of the photosensitizer with the biofilm, and then we can shine the light, and then we are able to kill more bacterial cells than just with APDT. We can, the CFU results, they were also supported by the confocal images. Once we can see the most of cells were red stained by the dye. So it means that we get a very good rate of killing of the bacteria once we associate these both techniques. We have also worked on the use of a different device to remove the dentin, the dentin caries lesion. It's a more conservative way to remove, and then we can combine the technique that I already showed you in the last slide, based on the combination of the use of ultrasound and antimicrobial photodynamic therapy. We can work based on the minimal invasive procedure. Once we can keep a more affected dentin, that it's possible to be decontaminated by some antimicrobial technique, and in this way we have used antimicrobial photodynamic therapy. So we publish another paper based on this association of techniques, where we use the ultrasound to remove the dentin caries lesion, and after that we performed the APDT to decontaminate the affected dentin, and after that we started the restorative procedure. So we could show in this paper that ultrasound was more conservative to remove the dental caries, and also PDT was able to decontaminate the dentin caries lesion, especially the affected dentin. Once we have worked here in Brazil with a minimal invasive procedures, just removing out the infected dentin. Here we can show some images where we can see the decontamination of the tubules by antimicrobial PDT. We can see the negative control where there is no any treatment, positive control where we use the chlorhexidine under 0.2%, and then we can associated the different mechanical techniques to remove the dentin, and after that to provide the decontamination of the tissue. In this way, in order to improve the results of antimicrobial photodynamic therapy over different oral biofilms, we have also associated APDT, different photosensitizers, especially methylene blue, that is one of the most common dyes used in dentistry. We have associated also CS6, chlorine E6, with hydrogen peroxide. And we can show that hydrogen peroxide can strongly improve the results of APDT over oral biofilms. So, as you know, hydrogen peroxide is a very well-known antimicrobial agent, and that is able to improve the effect of antimicrobial PDT over oral biofilms. So, in this same way, we have also associated different photosensitizers in different systems to provide the drug delivery of the photosensitizer, once most of them are no water soluble, and also to avoid the degradation of the photosensitizers before we shine the light. We have used some dyes as curcumin, that is a spicy compound, in pluronic F127 micelles to improve the results. So we have tested over different kinds of biofilms in vitro, especially a 72 hours culture biofilm of Streptococcus mutans and Candida albicans. And we have also, in this work, we tested the effect of antimicrobial PDT over a dual species biofilm. Once, of course, we have, it's more difficult to kill a multi-species biofilm than a single species. And of course, inside the oral mouth, this is more representative from the oral mouth than work just with a single species biofilm. So this is the paper that we published, showing where we showed the effect of antimicrobial PDT over a dual species biofilm, where we could show at least 3 log reduction, which is already a very good reduction according to the literature, to say that an antimicrobial agent or antimicrobial technique is showed a good effect. We should reach at least 3 log reduction of killing for different kinds of biofilms. Here we have another paper that we published using the association of chlorine E6 and hydrogen peroxide, and we show that hydrogen peroxide can improve the results of APDT. So to show the efficacy of antimicrobial PDT, we have done different studies in vitro, in vivo, in patients, Here in Brazil, we already applied antimicrobial PDT in the clinics, and we have got very nice and interesting results. This is another in vitro study where we used a new way to deliver the singlet oxygen that is one of the most important agents once we have the photodynamic reaction. This is the most agent responsible to kill the bacteria, the microorganisms. And this is a new way. It's a super hydrophobic surface where we can have the photosensitizer, and this is not where the photosensitizer is not delivered direct to the site that we want, and the ROS, the radical oxygen species are delivered from the system. So then we don't have the contact of the tissues with a solution, as we showed you in the previous work. So we could show that the inhibition was related to the light doses used. It means that the antimicrobial effect was based on the amount of light delivered. Of course, the concentration of the photosensitizer is also another important parameter that we can pay attention. And this is the in vitro study that we published last year, where we could show the effect of this new device, this different way to deliver the photosensitizer as a super hydrophobic surface. We could show that we under different light doses and under different concentrations, we are able to kill the different biofilms related to the periodontal disease. And we can show that the confocal images can support the CFU counting, the reduction of the bacteria after PDD. This is another paper that we published a couple of months ago. This is the in vivo study using a Wistar rat model where we developed the periodontal disease. And after that, we treated with this super hydrophobic surface. And we evaluated not just the antimicrobial effect, but the clinical and the histological parameters. And it was interesting that we could show the antimicrobial effect for this work, for this study. We used a photosensitizer already approved by FDA called Visudyne, and we could show that the super hydrophobic surface with this photosensitizer was able to inhibit the biofilm, and also we could see an improvement on the clinical parameters evaluated in this study, like the probing depth, the attachment loss, and we could evaluate it, all of them after 30 days in the beginning, after PDT, and after 30 days. Another interesting thing is that we could show that once we have the control of the biofilm, antimicrobial photodynamic therapy was also able to improve and to show some effect over the healing of the soft tissues through the time that we evaluate. So in this way, it's nice to emphasize that APDT can contribute with the control of the biofilm and also with the healing of the dental tissue. And we can already see these effects on the patients that we have treated here in the School of Dentistry. This is another study that we published, that we published, where we used the methylene blue in polymeric mice cells against Streptococcus mutans and Candida albicans biofilms. We could first we evaluated the properties of the system, the methylene blue loaded polymeric mice cells, and the purpose is to mainly avoid the degradation of the photosensitizer. Methylene blue is a soluble dye, but we work on that, and we could show that we can we can improve the antimicrobial results and show at least 3 log reduction when we associate this system methylene blue with polymeric mice cells. We can also show that the antimicrobial, the CFU counting is supported by the confocal images, where we can show more rate of dyed cells than live cells. This is, so we have worked in dentistry over different kinds of biofilms, biofilms related to the dental caries, endodontic infection, periodontal disease. And here we can also show another paper that we already published using curcumin based on a nanoparticle system, where we could show that this system can also improve the results over different kinds of biofilms, and also single species and multi-species biofilm. So, of course, all of these results that I am showing right now, of course, we needed to pay attention with the parameters that we are using, because all of them, like the light doses, concentration of the photosensitizers, type of the photosensitizers, and incubation time can directly affect the results of the different studies. So after I showed you our in vitro, in vivo experiments that we have performed here in the Biophotonics and Bionanomaterials lab, I would like to show you some clinical applications, how APDT can work in the clinics. So here we have an endodontic infection. Of course, I will not show you the details regarding the retreatment, because in this case, it was necessary to retreat this endodontic, channels, and of course we needed to go through the mechanical removal. It's important to emphasize that just APDT, just with APDT, we are not able to deliver, to have a very good result. Of course, APDT is a complementary and adjunctive treatment. So before that, we needed to mechanically remove the infection, the dental caries, and after that, we can go through APDT. So after the mechanical treatment of the root channels, we applied locally the photosensitizer. In this case, we used methylene blue under 0.01%. It's a solution already. It's already, you know, methylene blue is used for many and different purposes since many years ago. So this is a commercial presentation of this dye. So then after that, we needed to wait at least 5 minutes. And after 5 minutes, we can shine the light in the different channels by the use of this optical fiber. We can deliver the red light once methylene blue absorbs 660 nanometers. And in this case, we used a red laser. And of course, after the decontamination, we finish all the treatment, and we can already see some difference on the infection around the root canal, around the root. And here we can see already some difference. This X-ray is already from some months after, I believe 3 or 4 months after the treatment. This is another application that we have done here for the treatment of periodontal diseases, as gingivitis is one of the most common periodontal disease that we can have in the dental offices, and we have many patients here at the School of Dentistry that ask us to treatment. And of course, before start PDT, we needed to mechanically remove the biofilm, the dental calculus, and after that we can apply PDT. And what we can see, maybe someone could ask me, oh, but a methylene blue could stain the dental tissue, the soft tissue. Usually after PDT, we can go through a prophylaxis, or a 10% hydrogen peroxide is enough to remove the colorish over the hard and the soft tissue. In this case, we also use the methylene blue under 0.01%, 5 minutes incubation. Of course, the incubation time in dentistry, it's something very important. For the dentistry purpose, it's nice to have a shorter incubation times. Once, for example, if the patient should wait 1 hour to shine the light, you know, it's already difficult, because the time for the treatment could be significantly increased, and this is could be not very interesting. So this is the reason why usually we use 30 minutes, but maybe you could already see in the literature that for other applications, for example, systemic applications, usually patients come to the doctor and get the injection of the photosensitizers, and depending on the application, depending on the photosensitizer, they should wait hours and hours, and just after that, they will get the light application to get the results. This is especially happens once we have the application of photodynamic therapy over cancer cells, for example. So we have worked, of course, not just once. APDT is enough to inhibit the growth of the biofilm. Of course, we have now worked with repeated applications of APDT, and we can see that repeated applications can show more interesting and important results in dentistry. In conclusion, APDT is a very well documented technique in dentistry. We can see, and we already have many papers, of course, not just from my group here in Brazil. There are many other groups here, especially in Brazil and around the world, that have been working on that. APDT could be successfully used as an adjunctive technique in dentistry. As I told you, we should also, it's important to emphasize that APDT is a complementary technique. It's not just APDT responsible to treat these different diseases. Of course, for example, in caries lesion, periodontal disease, endodontics infection, we needed to go through the mechanical removal before started APDT. Combination of techniques can improve the results. We are now working on more experiments based on the association of ultrasound and photodynamic therapy, because we believe it, and based on our first results, this technique can really significantly improve the results of antimicrobial photodynamic therapy. More investigations regarding parameters should be performed. Once, if we have a look on the literature, many and different parameters have been used. And in my opinion, this is the most important thing that we need to work to make PDT a technique that can be used in the daily dentistry for many and different, for many dentists around the world. This is something that we need to go through, especially for clinical trials. Before I finish my talk, I would like to thank you so much, everyone from my research group, my undergrad and grad students that have been working very hard in the lab to in order to get the results of this very nice work, and also my collaborators, my Brazilian collaborators, international collaborators that have been contributed with our group here in Brazil. And you know, we never work alone, and behind the papers that I showed you, of course, there are lots and lots of people who get involved, and I would like to thank you so much for all of them. So thank you so much for your attention, And once again, I would like to thank you so much, Professor Dr. Marian and Professor Dr. Lakshman, for inviting me to join this very, very nice conference. And thank you so much again.